Up until it happened to me, I judged people without teeth. I always had an idea that people with missing, broken, black teeth were uneducated, impoverished, drug addicts.
Smiling was not a fun experience. I didn't really smile a lot.
Either they don't have any toothbrushes in the home or they share a toothbrush with their siblings.
The dentist looked at Tiffany. He said, "Tiffany can't open her mouth wide enough. I can't work with her."
I was in serious risk of losing my teeth.
Eastman Institute for Oral Health is many things
to many people.
We're dentists from around the world
who are training to be specialists in many different areas of dentistry,
including
pediatric dentistry,
periodontics,
hospital-based dentistry,
orthodontics, oral and maxillofacial surgery,
prosthodontics, orofacial pain and TMJ disorders,
advanced general dentistry.
We are leaders in the field who are teaching the next generation
of experts in clinical care and research.
We are scientists
who are making breakthrough discoveries in oral biology.
The research we're doing is in three main areas: cavities, cancer, and birth defects. Basically, we're working to improve patients' lives.
As a proud part of the University of Rochester Medical Center, clinical care is still one of our main purposes, as it was 100 years ago when George Eastman established the dental dispensary on Main Street in Rochester, New York. But since the early 1930s, we've greatly expanded Mr. Eastman's original mission, adding a robust research component and postdoctoral training programs.
Most importantly, over the last 100 years, we've been helping thousands of people who need it most.
Eastman Dental established the state's first mobile dental unit, helping city children receive dental treatment who otherwise wouldn't receive care at all.
Our partnerships with many community organizations allows us to be successful.
If it weren't for the Eastman Smile-Mobile, a lot of our kids would get no dental care at all. They would be suffering from abscesses, decay. You can't learn if your mouth is hurting or even if you don't feel good about yourself.
Many of our patients have very challenging situations.
I was having these caps fall out of my mouth and the infections. And I did not have dental insurance and was a single mother of 2 boys. It was very humiliating.
I was definitely in shock. I was terrified. I was overwhelmed.
I was in a lot of pain as I got older, a lot of pain joint-wise. I would have headaches.
I had this acid reflux that was constantly coming up into my mouth and essentially destroying the enamel on my teeth, putting me into extreme pain, making it very difficult to eat.
We went to doctor after doctor after doctor, and every single doctor we went to, no, we can't really do this. No, this is going to cost you a ton of money. No, 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 no. A lot of the dentists that we've seen wouldn't even bother trying to communicate with her. They would just try to force her mouth open, or they would just do things without talking to her. They just didn't treat her like a person.
I was anticipating losing my teeth, but the implant specialist told me, no, go to Eastman and solve the problem.
At Eastman Institute, we help many people who have complex cases
other providers aren't trained or are unable to treat.
So we use the operating room to treat children that have the most severe decay. Oftentimes they'll have 10, 12, 20 cavities in their baby teeth. Cavities that are so severe that oftentimes we have to do baby root canals, put some silver caps on them. Last year in Rochester, we treated over 750 children in the operating room.
It is our strong desire and intention
to continue helping people with unique and medically complex situations,
to give them the highest quality care they require and deserve.
When we first met with the cleft team, they let us know about this thing called NAM, which is only offered at Eastman and in New York City. It closes the gap in the baby's mouth. It will reduce the number of surgeries that Jacob has to have going forward in life.
We were pioneers in treating patients with special needs by introducing new techniques to help children and adults with intellectual and developmental disabilities.
As soon as we walked in, it felt really good. Every dentist has been so patient and understanding.
We got an amazing result that we wouldn't have had if we didn't have such a caring and supportive team that we truly trusted and considered basically to be our family.
Kids that go to the Smile-Mobile are better prepared. They definitely have much better oral hygiene. It's really been a great service for our school.
I'm happy with how I can speak and how I can smile and how I can chew without any problems.
I went to Eastman, and essentially they have solved the problem. She went at it from a medical perspective first. Then she went at it as a dental perspective, and she gave me the solution, which I'm so happy with.
I speak with confidence. I can chew anything that I want to. The work was just amazing, and the quality of my life has changed so much.
We were fortunate that we found Eastman. They're the perfect choice for her.
There are doctors everywhere, but dental care is just so hard.
And it's so important.
It's important to the rest of her health. I don't think you really know what that means to us as parents.
It's really hard to put into words what Eastman has done for my son.
Eastman Institute for Oral Health has been leading the way through innovative clinical treatment by training highly skilled dentists and advancing knowledge through research. The specialists we train take their new skill and experience
throughout the United States and around the world.
Imagine.
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 Imagine what the next 100 years can bring. From the time George Eastman established the dispensary, we remain dedicated to serving the community, educating and training the next generations of specialists, and advancing our knowledge through basic and translational research. We do the best we can to bring quality and joy back to thousands of people's lives. At Eastman Institute for Oral Health, we will continue to make an impact in Rochester, the nation, and the world.
If it wasn't for Eastman, Jake would not have the beautiful smile that he has today.
I could work my whole life and never really repay what Dr. Paulin and Eastman did for me.
I don't know where I would be today if I didn't have my smile intact and those terrible infections out of my mouth. I feel like it was an answer to prayer. I now look at people with missing teeth with such compassion.